North Carolina is receiving more supplies from the Strategic National Stockpile to help deal with the novel coronavirus, but state leaders say it is still not enough.
Yeah, CBS 17's Capitol reporter Michael Hyland on top of this story live at the state's Emergency Operations Center. And Michael, there's also a shift in how the state is testing people for COVID-19 as well.
Right. What state health officials are saying is that people with mild symptoms don't necessarily need to leave their homes just to get a test and risk putting other people at risk for getting this virus, including medical workers. But there are other leaders in state government who say they want more data about what's going on to better make decisions. Medical supplies and other equipment are coming into North Carolina from the Strategic National Stockpile. Hospitals are preparing for a surge of patients amid the COVID-19 pandemic.
There's no way that we can sit and tell you that we have enough here in North Carolina. We are working very vigorously to order more supplies.
In a conference call Tuesday morning, the Secretary of the state's Department of Health and Human Services points out the differences between COVID-19 and the flu when it comes to who ends up in the hospital. The flu, it's about 2% of people, compared to about 19% of COVID-19 patients. State health officials say at least 8,500 people have been tested, but acknowledge they're not identifying all the cases. Republican State Senator Andy Wells says he's concerned about the amount of testing, wanting a clearer picture of how widespread the disease is. The state legislature will have to vote on a variety of ways to respond to the crisis.
We're also making decisions that are going to affect people's lives financially. People are out of work. They don't have savings. Their mortgages are at risk. Their financial future is at risk. We need to get the data.
There's people with very mild symptoms or no symptoms. So the way to understand the spread across the state is not to try to test everybody. Instead, what we're doing and we'll be pivoting to is using our evidence-based surveillance strategies that we use for influenza.
Health officials say they're trying to preserve what equipment they have, which is a factor in not recommending that everybody get tested. They also expect there to be confirmed cases of COVID-19 in all of the state's 100 counties, probably within the next week. Live in Raleigh, Michael Hyland, CBS 17 News.